This is Melanie Markham, and what I'm going to speak to you about today is hospice care. Hospice is a program that's provided to individuals that have been told that they have less than 6 months to live if their disease runs its normal course. Now, sometimes people go beyond this and hospice will stay with them as long as they show decline, but for the most part, individuals are at the end of their life and need the services that hospice can provide. And that's what's great about hospice, is it does provide service, equipment, supplies, medication, all focused on keeping that person comfortable and trying to support them during this challenging time. Hospice cannot just be a cancer diagnosis. It may be a end-of-stage heart disease or an end-of-stage lung disease, Alzheimer's, kidney disease, anything that might be bringing that person to this time of their life. The services of hospice can include a doctor that'll be a medical doctor that's trained in hospice care, and he can complement those services that their primary care physician, or he can become the primary care physician, whatever that patient chooses to do. There'll be a nurse assigned to that person. An RN will manage their care and help coordinate the other team members that are all going to be focused to help that person. It may be a chaplain, a social worker, personal care aide, homemaker services. There's volunteers to run errands or help relieve the family, and there's a bereavement counselor. And the patient has always the right to choose any or part of these services. However, the professional services will always be part of the team, reviewing that client and making sure that there's everything thought of for their particular course or case to make them comfortable, which is what hospice people want to do, and they're usually the cream of the cream. They're people that really care, because it's such a challenging time to come alongside someone and watch them go through this process. The chaplain's there to help with any spiritual needs. The social worker can address and make any arrangements that the patient or family may have made. The personal care hospice aide's there to help them with personal hygiene as they get weak and need that assistance. That can be a real value. Or the homemaker that can help keep their room or their house clean, which will always make them feel a little better. Or run those errands that they can't get out and do themselves or their family can't do. So those volunteers can really be of benefit in a hospice program. The bereavement counselor really helps with the family, because they carry on 13 months after the patient has passed away and will visit during holidays or anniversaries or any of those difficult times. And the families have found this quite helpful, and it is a sense of solace to the patient that knows someone will be looking out after family. Medications that are related to the hospice diagnosis are covered. And then there's the equipment like a hospital bed or oxygen that can be covered under the hospice program. Additionally, there are supplies that may be needed in case there is a wound or a bandage that needs to be addressed during the course of care. There may be other supplies that the patient needs, and the hospice will provide those. So it's a very valuable program for individuals that are facing death, and we want to encourage everyone to make sure that people are aware of the program, and the more people that know about it, the better it can be used, and we can help those people just like we would want to be helped. Thanks for listening.